Hi, I'm Desiree Hornung. I am one of the nurses here in the Roxbury School District, specifically at Eisenhower. I'm here today on behalf of all of the nurses to welcome everyone back and say that we look forward to seeing you all. And we just wanted to go over some infection prevention basics, our illness protocol, and just in general, some of the changes that you and your children will notice throughout the school year. So, let's talk a little bit about COVID-19. What is it? Also known as SARS-CoV-2, it's a new virus, affects the respiratory system often. Anyone can be infected. Most cases are mild, but there can be severe or even fatal cases, and we're still learning about it. How is it spread? So, COVID-19 is spread through droplets and pretty easily when we talk, cough, or sneeze. People can become infected when these droplets enter the eyes, nose, or mouth. So it's really important for everyone to be keeping their hands away from their face. Touching contaminated objects or surfaces then puts the droplets onto your hand, and if you touch your face, the droplets can then enter through your eyes, nose, or mouth. So, our 6 W's for returning to school during a pandemic include wearing a mask, washing your hands, watching your distance. When sick, stay home. When the health department calls, please answer. This really will aid in their contact tracing efforts. And windows and doors will be kept open for airflow. So, what is infection control? It stops the spread of infection and it protects individuals from becoming infected. Standard precautions are precautions that are used for all, since we often do not know who has COVID-19 and sometimes they don't even have symptoms. It includes hand hygiene and use of appropriate personal protective equipment or PPE. So, for example, we'll be wearing face coverings at all times. Strategies that can be implemented include health questionnaires, avoiding exposure, our face coverings, and social distancing. Other control measures can include hand sanitizing stations, limiting points of entry, cohorting, limiting group sizes, and virtual as needed. Lots of education. There are signs throughout all of our buildings, different visual alerts, and floor markings as well, and isolating those who are ill. Hand hygiene is simply just cleaning one's hands in a way that reduces potential pathogens on the hands. And it includes the use of an alcohol-based hand rub or washing with soap and water. All of our buildings have different hand washing signage and posters. We have lots of good videos to demonstrate hand washing as well. So, when are we washing our hands? We are washing upon arrival at school, before and after any meals or snacks, after going to the bathroom, before leaving for the day, after blowing our noses, sneezing, or coughing, and using soap and water if our hands are visibly dirty. So, for face coverings, the CDC recommends that people wear face coverings when in public settings, especially when we're around people who don't live in our household, and especially when social distancing measures are difficult to maintain. Some highlights include cleaning your hands before putting the face covering on, and after removing your face mask, you'll want to sanitize your hands as well. Making sure your nose is covered in addition to your mouth, very important. Do not touch the front of your mask. You want to remove your mask by touching only the ear loops or ties, never the front of it. And we just ask that we're not using face coverings with exhalation valves because your air is going to be blown out of them. We have a lot of different signage on the use of face coverings, and just want to point out that the risk of transmission is a lot less when everyone is wearing a face covering. Respiratory etiquette, that is simply just covering your mouth and nose when coughing or sneezing. You'll want to use a tissue or a sleeve to cover it up, and then follow up with some hand hygiene. Staying home when sick. So according to the New Jersey Department of Health, students and staff should stay home if they have tested positive for COVID, if they have COVID-19 symptoms or potential exposure to COVID-19, if you've had recent close contact, which is being within 6 feet of someone for at least 10 minutes with a person who's had COVID-19 in the past 14 days. And then we also have different travel advisory lists. New Jersey has a travel list that they update as far as out of if you travel out of the state. And then the CDC updates the international travel list as far as different countries go. So an exclusion guidance flowchart that just tells us how to exclude someone from school and for how long they would need to be excluded from school based on the New Jersey Department of Health and CDC guidelines. In addition, we collaborate with the local health department, and we're also supported by our school physicians. And understanding that COVID-19 may impact certain areas of the state differently, the Department of Health is providing information on COVID-19 transmission at the regional level. So information will be posted online every week as far as our region goes and what level of risk we are currently at. So they would characterize risk as low, moderate, high, and very high, depending on COVID-19 reports in our community. The local health departments should use this regional risk matrix when they're providing guidance for schools on actions that we should take based on the level of COVID-19 in our region. And I'm just going to pull this up just so you can take a peek at it. And so, for example, no flags, you have a normal health screening, you're proceeding to school. You may have been exposed to COVID-19, but you're feeling fine. You can proceed to school or work, contact your healthcare provider. You're going to continue your physical distancing and monitoring for symptoms. And then if symptoms appear, you're going to head to your healthcare provider. And you're going to keep moving down the chart, but for instance, we'll take a look at the red. If there is a positive diagnosis of COVID-19, and that's with or without symptoms, you cannot go to school or work for, it has to be 10 days since the start of your symptoms or a positive COVID-19 test if you had no symptoms. So in order to return to school, you would have to have improving symptoms and 24 hours fever-free without fever-reducing medication to return after those 10 days. So these are some of the things that we're looking at when clearing someone to return back to school. So, health office visits will look slightly different this year. In order to minimize the possible exposure of a healthy person, staff will need to use the following guidelines for sending students to the health office, which include always calling prior to sending a student so we can make sure that we're adhering to our social distancing guidelines, and also so the nurse knows how to prepare for the student visit, including possible isolation if the student is ill. We are encouraging students to perform self-care for simple things such as applying a Band-Aid for something like a paper cut. They'd be instructed to wash their hands and then apply the bandage themselves. If a student, however, is having difficulty performing self-care, there are times where the nurse may choose to come to the classroom door with a procedure cart to quickly provide first aid, enabling the student to remain in class. And students will be encouraged to use mindfulness and relaxation techniques to control anxiety, which is often manifested by symptoms such as headaches and stomach aches. The isolation room is just a separate space right next door to our health offices for monitoring, and it is where students will await pickup to go home if they're displaying COVID-like symptoms. So we just ask that you please make sure your emergency contact information has been updated and that your child can be picked up promptly in the event of illness. So your daily routine before school should include a wellness check where you're going to monitor your child's temperature and monitor for any symptoms that they're reporting or that you're visualizing. So we ask that you keep your student home for at least one of the following symptoms, such as a fever, which is a temperature of 100 degrees or greater, new onset cough, shortness of breath or difficulty breathing, vomiting, diarrhea, or loss of taste or smell. We also ask that you keep your student home for at least two of the following of these COVID-like symptoms, which includes sore throat, chills, muscle or body aches, a new onset headache, congestion or a runny nose unrelated to allergies, nausea or fatigue. Please note that the students will be sent home from school also based on the same criteria. So if well and symptom-free, you'll go to school with your face covering, no exhalation valves, wash your hands upon arriving to school and often throughout the day, practice social distancing, and bring your water bottle to stay hydrated. If your student is symptomatic or if you're unable to attest to their wellness, you'll keep your student home and away from other people and contact your healthcare provider. If your child's illness is confirmed as COVID-19, family members may also be required to quarantine for up to 14 days. So it's important to let all of the school buildings that your children attend know, and also important to seek medical guidance to stop the community spread of COVID. And coping with COVID stressors. So we want to acknowledge that it is stressful and that the effects can be both physical and emotional. And some things that you can do to reduce stress related to COVID include taking a break from your social media or the news and try to engage in activities that you enjoy, eating healthy, exercising, practice mindfulness, and just note if your stress is keeping you from your daily activities or your anxiety is escalating. You want to talk to your doctor or someone you trust. And we have a lot of resources for our families here and on our website. So we encourage you to take a look at them. And as always, reach out to your building nurse if you have any questions or concerns. So I thank you for your time, And we look forward to a great school year. Wish you the best of luck. And again, if you need anything, always reach out to your school nurse by email, and we'll get back to you as soon as we can. Thank you. Have a good school year. Good luck.